Everyone, my name is Gianluca Di Censo, and I'm going to talk to you today about alcohol, tobacco, and other drug use among Australian workers. So imagine a construction or mining site where nearly every second worker is drinking at high risk levels. This isn't a hypothetical scenario, it is the reality revealed by our latest data. Alcohol, tobacco, and illicit drug use significantly impact the productivity, safety, and well-being of the Australian workforce. The workplace is a key setting to identify problematic use of substances and to implement interventions to combat such use. Therefore, the aim of the present study was to determine which industries have the highest use of alcohol, tobacco, and other drugs. This research is important because identifying workforce groups most susceptible to substance use is critical for targeting industries that are most likely to benefit from interventions. This information is essential for industry, health and safety, professionals, public health researchers, and policymakers, as it can guide targeted interventions and universal health promotion strategies focused on reducing use and educating workers about the associated harms of use. Previous research has predominantly focused on the prevalence of substance use. However, estimating workforce population sizes is less common, but is crucial for identifying the largest population that could benefit from reducing substance use and could yield significant returns on investment from large-scale substance use interventions. We use data from the 2022-2023 National Drug Strategy Household Survey and focused only on employed Australians. The independent variable for this study is the industry in which participants were employed, as defined by the Australian and New Zealand Standard Industrial Classification. The dependent variables were high-risk alcohol use, tobacco smoking, and past-year illicit drug use. We conducted our analyses in R and utilized the survey package to apply survey weights. So what were our findings? This is a snapshot of where high-risk drinking is most concentrated in the workforce. If one wants to reduce the total burden, one would focus on healthcare, construction, and education, as these industries had the largest numbers of high-risk drinkers. If the objective is to tackle the greatest concentration of high-risk use, the sectors of mining, construction, and utilities exhibit the highest rates of high-risk drinkers. Lastly, to pinpoint sectors where employees might be particularly at risk, potentially due to stress or the prevailing workplace culture or norms, one should consider evidence from our regression model. The findings indicate that the admin and mining industries emerge as sectors linked to higher odds of use when contrasted with the education sector after accounting for covariates. This provides an overview of smoking. So to reduce the overall burden of smoking, attention should be directed towards the healthcare, construction, and hospitality sectors, as these are sectors that report the largest numbers of smokers. According to the analysis, the highest prevalence of smoking was observed in the admin, mining, and hospitality sectors. Lastly, we found that the admin and retail trade sectors exhibited higher odds of usage in comparison to the education sector after adjusting for covariates. Finally, here's a quick rundown of the numbers regarding illicit drug use in the workforce. The healthcare, hospitality, and construction industries had the largest numbers of workers who used illicit drugs. The hospitality, construction, and mining industries had the highest prevalence of individuals who used illicit drugs. And lastly, individuals employed in the utilities, mining, hospitality, and construction sectors exhibited greater odds of use in comparison to their counterparts in the education sector after adjusting for covariates. So which industries to target really depends on whether we want to reduce total burden, density of use, or vulnerability. If we want to create interventions to target the most people, we should consider the estimated population size of users and focus on sectors such as healthcare, construction, and hospitality. If we're trying to target the industries that exhibit a high concentration of use, we would be looking at prevalence, and the industries that we would be targeting interventions at would be mining, hospitality, and construction. If we are most interested in targeting interventions at industries that exhibit an increased vulnerability of use, we would be looking at adjusted odd ratios, and in that case, we would target interventions at admin, mining, and utilities. So some implications for policy and practice would be to target high burden industries with screening, health promotion, and referrals. Research indicates that strategies like screening and brief intervention can be effectively applied in workplace settings, resulting in decreases in substance use. Given that workplaces possess distinct demands, stresses, cultures, and implementation barriers, it is imperative for decision makers to prioritize the co-design of interventions. This is especially pertinent in male-dominated industries, as these sectors tend to be the most resistant to change and have been highlighted in the current study for their significantly high rates of substance use. The key takeaway from this study is that the use of alcohol, tobacco, and other drugs is not evenly distributed across the workforce, and consequently, prevention efforts should reflect this. Focusing on the appropriate workplaces is crucial, and this may result in substantial decreases in use among the wider community. It is essential that we develop tailored, industry-specific approaches to mitigate use. Integrating screening, brief intervention, and referral to treatment can also be an effective strategy to reduce harmful substance use behaviors. Engaging industries in the collaborative design of interventions is crucial, and we need to ensure that policy is in harmony with this approach. Lastly, it is essential to maintain a data-driven approach to prioritize funding and assess impact over time. If you'd like to read more about the research, please scan the QR code on the screen to access the publication. Thank you for listening.